Imagine being told your life-saving treatment just became harder to access simply because of a new law. For millions of dialysis patients, this isn't a what if. It's becoming a reality under what's being called Trump's One Big Beautiful Bill. Today, we're breaking down exactly what this bill means for you, your loved ones, and your wallet, and your life. Stick around, because the details in this one, they matter. Hey Warriors, welcome back to Dialysis Warrior. I'm Colin, and this is the channel where we talk about what it really means to live with kidney disease. Whether you're a patient, a caregiver, or just someone trying to make sense of the system, this channel is here to give you the truth, the tools, and the strength to not just survive, but thrive. Today we're covering a big one, a new law passed on July 4th, 2025, nicknamed the Big Beautiful Bill. Is set to shake up healthcare, Medicaid, and the support systems many dialysis patients depend on. Some are calling it reform, others are calling it a crisis. Let's get into what this bill really says, how it could affect you, and what we can do next. So what exactly is this big, beautiful bill? Officially signed into law by President Trump on July 4, 2025, it's a sweeping federal reform bill that combines healthcare changes, tax policy, budget reallocations, and state power shifts all in one massive package. According to supporters, this law is about reducing federal overreach, trimming waste, and giving states more freedom to design their healthcare programs. But here's the catch. Buried inside this 900-plus page bill are serious implications for people with chronic illnesses, especially dialysis patients. Key features of the bill include Medicaid funding cuts, new work requirements, caps on state provider tax mechanisms, increased patient cost sharing, stricter eligibility and recertification timelines. On paper, it's framed as a way to make the system more sustainable. In reality, it may be making treatment less accessible for the people who need it most. Let's talk about Medicaid, because for many people on dialysis, it's not just insurance, it's survival. Roughly 30% of dialysis patients rely on Medicaid. These are often low-income patients, people too young for Medicare, or folks wanting SSDI approval. Without Medicaid, many wouldn't be able to afford treatment. Before this bill, most states, especially those that expanded Medicaid under the ACA, covered dialysis care with little to no out-of-pocket costs. That included dialysis sessions, lab work, medications, and transplant evaluations. And here's a little known fact, many states funded this through something called provider taxes. Basically fees hospitals or dialysis centers paid that the state then used to draw down federal matching funds. Well, guess what? The Big Beautiful Bill puts new limits on those taxes, shrinking how much money states can use to fund care. In plain English, there's less money in the pot, and that means patients could end up paying the price. Now let's talk dollars, because this bill introduces new copays for many patients. Under the new law, Medicaid recipients with incomes between 100% and 138% of the federal poverty line must now pay $35 per dialysis session. Think about that. Dialysis is 3 times a week, 156 sessions per year. 35 times 156 equals $5,460 per year out of pocket. That's not including follow-up appointments, lab tests, prescription meds, and transportation costs. For someone already struggling to afford rent, food, or utilities, this is a crushing blow. Let me be clear, no one should have to choose between staying alive and staying afloat financially. But this bill creates that exact dilemma for thousands of people. Another major change, work requirements. The bill mandates that Medicaid recipients between ages 19 and 64 must complete at least 80 hours a month of work or community engagement activities. Here's the thing, yes, there are exemptions for people who are medically frail. But States can decide how strict or lenient they are with those exemptions. Many patients, especially new ones or those without advocates, might not know how to apply or appeal. Missing one form or deadline could mean instant loss of coverage. Now ask yourself, how many people on dialysis dealing with fatigue, blood pressure swings, nausea, and infections can reliably work 20 hours a week? This isn't a get lazy people back to work issue. This is a healthcare cliff that many sick patients are going to fall off. Next up, red tape. Before this law, most Medicaid programs only required patients to recertify once per year. That meant once a year you'd send in your paperwork to prove you still qualify. Now it's every 6 months. That means more paperwork, more deadlines, more chances to make a small mistake that causes a big problem. For someone on dialysis, managing fluid limits, diet, multiple prescriptions, doctor visits, and treatment schedules, this is just one more thing to juggle. And the penalty for missing a deadline? Interrupted care. Let that sink in. You could be doing everything right for your health and still get dropped from coverage because of an overdue form. Let's zoom out for a second and talk about how this bill affects the actual places you get treatment. As I mentioned earlier, the bill caps how states can use provider taxes to fund Medicaid. That cuts off a major source of funding for rural hospitals, community health centers, and dialysis clinics. If these clinics don't get reimbursed properly, they may have to reduce their hours, cut staff, or close down altogether. This creates what health experts call dialysis deserts, entire counties where there's no access to treatment within a reasonable distance. The National Kidney Foundation has already sounded the alarm. This law may create access gaps for thousands of patients, especially in Black, Hispanic, and Native communities. So how many people are we talking about? According to the Congressional Budget Office, an estimated 10.9 million Americans could lose some form of health coverage under this law. Dialysis patients in that group may experience complete loss of Medicaid, ineligibility for subsidized marketplace plans, and skyrocketing medical debt, delayed or skipped treatments, and higher mortality risk. For a disease that already claims too many lives, this isn't just policy, it's survival. Now, in fairness, let's talk about what the supporters of the bill are saying. They argue the system was unsustainable, Medicaid fraud is rampant, and needed to be addressed. States should be trusted to tailor programs to their populations. Budget cuts are necessary to reinvest in defense, infrastructure, and national security. A $50 billion rural hospital stabilization fund has been introduced to offset closures. But here's the problem. There's no guarantee dialysis centers will see a dime of that fund, and fraud prevention becomes meaningless if the process blocks honest patients from accessing care. On the other side, critics, including the National Kidney Foundation, the American Society of Nephrology, and multiple state Medicaid directors, say the bill places unfair burdens on the most vulnerable, introduces complex paperwork that automatically leads to drop coverage, punishes patients for being sick, fails to reinvest in the very programs it cuts. They warn that we may see higher hospitalizations, more emergency room use, and rising mortality rates in dialysis patients if these changes go unchecked. So here's the bottom line. If you're a dialysis patient or care for one and rely on Medicaid, this law could drastically reshape your reality. It could mean paying thousands out of pocket or getting dropped from coverage, traveling hours to find an open clinic, facing impossible choices every month. But here's the thing, you don't have to go through this blind. You deserve to know what's happening and what your options are. If you found this breakdown helpful, hit that like button. It helps this video reach other dialysis patients who need this information. Subscribe to Dialysis Warrior for more tips and real-life strategies for thriving on dialysis. Leave a comment below. Are you affected by this bill? Have your costs gone up? Has your clinic said anything yet? And if you need help or more resources, visit dialysiswarrior.com. We've got your back. Until next time, Warriors, keep fighting, stay informed, stay powerful. You're not just surviving dialysis, you're mastering it.